I'd like to acknowledge the traditional owners on the land on which we meet, the Yungabear people, and pay my respect to the elders past, present and emerging, and all the Aboriginal and Torres Strait Islander people here today. I'd like to add that Indigenous health remains an overarching priority of the RDAA. Wow, what a cracking conference. Thank you all so much for coming and contributing to our biggest and I'd say our best conference in the history of RMA. Last night's dinner was truly spectacular, continuing on the amazing vibe that has defined this conference. Huge congrats to the ACRM and RDAA staff for hitting the 1K mark and delivering such an amazing event. Woo! So my name is John Hall and I'm honoured and excited to be taking on the role of the RDAA presidency for the next 2 years. The wave of change for me has been more like a tsunami, as I've also recently been appointed as the Director of Medical Services for the Oka Health Group. I'm proud to be partnering with a well-respected GP group and recruitment service that are born and bred rural and have been great supporters for the Rural Doctors Movement and RMA for many years. I'd like to thank our outgoing President, Dr. Adam Kaltsal. Adam and I go way back. He's not only a highly respected colleague, he's a great mate, with our friendship beginning back in medical school. It's been an absolute pleasure to share the journey towards rural practice and beyond with him. As you all know, he's a top bloke who is driven by his passion for rural communities and the doctors who serve them. Adam has done us all proud over the last 2 years, representing the tribe with his honest, articulate and forthright style. As you know, he has worked tirelessly, with his most notable achievement being his dogged pursuit of the National Rural Generalist Pathway and finally securing a commitment from the government to implement and fund it. I wish him all the best in his new role as the Medical Superintendent of St George Hospital. I'd also like to pay tribute to the hard work of all the past presidents of RDAA. Without them, we would not have had many of the policies and conditions and incentives that are in place today. Without RDAA, there would be no ACRM. ACRM was born at a time when no other college would take up the mantle of providing rural medical specialty training in Australia. ACRM has matured and grown to become the peak body in Australia for rural medical standards and training. The tireless and strategic work from Adam and our past President's Board and Federal Office has seen some major reforms in the rural health space in the recent years, including the pre-vocational rural placement programs, the development of the National Rural Generalist Pathway, the implementation of the Triple M model of classification of rurality, a commitment of $62 million towards the implementation of the Rural Generalist Pathway, direct GP to patient telehealth for mental health in remote areas, GP rural incentive payments, guiding and rural proofing PIP reform and protection of the rural procedural, Indigenous and after hours practice incentive payments, to name a few. I'm also proud of RDAA's track record when it comes to rural public health and raising awareness for mental health, suicide prevention, farm safety, skin cancer, rural birthing, telemedicine, Indigenous health and rural health workforce advocacy. The other great asset for RDAA in these past years has been the recruitment of Peter Rutherford as our CEO. Peter was headhunted from a high-level role in Queensland Health due to her leadership skills and involvement in the setup of their successful and exemplary Rural Generalist Pathway. Peter followed on from Jenny Johnson's excellent work but came along just at the right time for us to help establish and work on the development of their National RG pathway. Peter's deep knowledge and understanding of workforce issues, HR and governance has been a real strength for RDAA over this time. Peter has led by example with enthusiasm and passion. Peter has been a long-time friend and colleague, and I'm really looking forward to working with her and the team over the course of my presidency. The RDAA team is small and punches well above its weight. Linda has been holding the office together for many years. She's always been the right-hand woman of our CEOs and has been a key player in delivering just about everything that RDAA does. After 15 years with RDAA, Linda is retiring at the end of the year, and we're all going to miss her. So thank you, Linda. We wish you all the best with your move to Victoria, but we really hope to still see you around at some of our events because you will always be part of the Rural Doctor family. So I'd like you now to all join with me in thanking Linda for her tireless service to RDAA. RDAA enjoys significant media traction and impact, thanks in no small part to our prolific media and policy team based in Canberra, who just recently, on air, were congratulated by a journalist for the standard and quality of their media releases in the way that they deliver the media message to the media themselves. Our media team is headed up by Patrick, assisted ably by Inika, who has increased her workload this year with the addition of our Destination Rural project. This project has been a real coup for Peter and the RDAA, securing over $300,000 in government funding to work on rural career promotion to junior doctors. This has been a great opportunity for us to reach out to junior doctors and show them the benefits of working and training rurally. Anita, our senior policy advisor, is incredibly stoic and productive, pulling together policy documents often at short notice. I would like to thank our team from the office in Canberra for their excellent work. I'm so excited to be taking on the role of the RDAA President for the next 2 years. I've got 5 key priorities for my presidency, including the National Rural Generalist Pathway and Health Workforce Distribution, credentialing and scope of clinical practice, the protection and advancement of rural maternity units and hospitals, revitalising and protecting the role of rural GPs in pre-hospital and retrieval medicine, and rural non-GP specialist recruitment and engagement. So on the Rural Generalist Pathway, I hope to be able to ensure the National Rural Generalist Pathway becomes a reality and help guide its implementation. RDAA was the key instigator and driver of this policy. I will advocate for and support true generalism. Siloed advanced skills and subspecialisation of rural generalist practice can make workforce allocation and rostering difficult. We may need to explore innovative solutions like supporting individuals to gain more than one advanced skill, like the RGs of old, and combinations of procedural and cognitive advanced skills to meet the workforce needs. On credentialing and scope of clinical practice, I'd like to say that there is a ridiculous amount of red tape involved to provide our services as we cross jurisdictions around the country. Too often our scope is being eroded by risk-averse policies that lead to unnecessary patient transfer and dislocation. I will work towards the establishment of a national repository where credentials can be stored and accessed centrally by health services across the nation. We will fiercely protect the rural clinical space from incursions by other specialties and ensure that rural doctors set and maintain the standards for rural practice. On maternity units and hospitals, I will continue and extend my campaign for the protection, strengthening and reopening of maternity units right across the country. In particular, recognising the significant impact the closures have had on our First Nations people, and will ensure that Indigenous communities are involved in the reform and maintenance of maternity services. Pre-hospital is another area of strong interest that you would know about. It's important to improve the role of rural doctors in the pre-hospital and retrieval and disaster medicine space. In recent years, there have been multiple member reports of rural doctors being excluded from the pre-hospital and disaster response. For example, the Kerang rail incident in Victoria. Rural generalists with appropriate skills and credentialing should be considered key assets on the ground, working closely with retrieval specialists, especially prior to the arrival of the retrieval teams. We already are collaborating closely with ACRM and the relevant colleges to develop a pre-hospital and retrieval medicine qualification for credentialing. RDAA is already actively working to engage more closely with rural specialists, working towards a fit-for-purpose rural specialist workforce. Rural and regional areas are chronically undersupplied by specialists, and we need to find ways of improving this access, whether that be attracting them to the area with increased training opportunities, incentives, or innovative models of care. So now you know the who, the what, the when, and the where of what I'll be doing over the next 2 years, but I'm most eager to leave you with my why. I've been involved in rural health advocacy for over 20 years now, because I believe that rural communities deserve equitable and accessible health care. Rural and Indigenous health outcomes continue to show this is not the case. Year on year, rural Australians miss out on over $2 billion of federal funding because they can't access Medicare billable services. This is a travesty. I believe that it's a basic human right to have access to emergency care, primary care and birthing close to home. I believe that to close the gap for Indigenous Australians, we need accessible rural hospitals and health services working collaboratively alongside the community-controlled sector. If we get the end-to-end rural training pipeline right, we will have the workforce to staff these services. I believe that in the end, what is good for our rural communities will be good for the doctors who live and work there. As you can see, there's much to be done on the back of the progress so far. I'm really looking forward to rolling up my sleeves and getting on with the job. Remember, there's safety in numbers. Like herd immunity, with numbers comes influence and resources. So please consider strongly RDAA membership to enable us to do more for you and the communities that we serve. Once again, thank you all so much for coming, and I look forward to seeing you all next year. All the best and cheers.